Good afternoon to all of our guests here on the East Coast, and good morning to you on the West Coast. Thank you for taking your time to join us today for Mended Hearts Inc.'s Lunch and Learn with patient advocate Beth Waldron, where we plan to discuss non-medical switching, what non-medical switching is, and how it impacts cardiovascular patients, and really the importance of self-advocacy and making sure that patients get the care that they need. As many of you may know, last year, CVS Caremark announced that they'd no longer list Eliquis on some of their formularies beginning in 2022. This practice is known as non-medical switching, and Beth was impacted by this decision and shifted her work towards raising awareness about non-medical switching and urging lawmakers, policymakers, and CVS themselves to establish federal regulations for pharmacy benefit managers so that patients wouldn't end up in similar situation. Thankfully, due to advocacy efforts from many patient advocates and cardiovascular community stakeholders, including Mended Hearts, CVS announced earlier this year that they would add Eliquis back to their formulary. Despite this, protections like Beth has proposed have yet to be enacted, and the cardiovascular community is continuing to raise awareness and are working to address these instances if non-medical switching were to arise in the future. We welcome Beth today to share her story on non-medical switching and her journey in becoming a patient advocate and provide our audience with actionable advice on how to advocate for yourself in instances of non-medical switching. We're going to start today with a video detailing Beth's story.
In that moment, you are absolutely alone, and you're alone with your own mortality. And that was the first time I really became aware that I could die from this. When I was 34 years old, I was diagnosed with blood clots in both lungs and a blood clot in my left leg. I was hospitalized for 9 days. All I could think of was I've got a child to take care of, and I've got a husband, and I can't die. I first met my current doctor immediately after I was diagnosed with my blood clots 18 years ago. And then I got this letter. It was from my insurance company, and it said that the medication I've been on for the last 8 years, I'm not going to be able to continue on it anymore, and I'm going to have to switch to another brand of medication. And I was shocked. Non-medical switching is when patients like me are forced to switch medications for reasons that are not medical. It's dangerous, especially in a class of drugs like the blood thinner I take. It can actually be downright deadly. And this affects so many patients every year. We need to have decisions be between a patient and their doctor only. My insurance company does not know me. They do not know my medical history. My doctor knows me. My doctor knows my medical history. He has worked with me for 18 years. I trust him. If a patient is stable on their medication, no matter what that medication is, let them stay on it. It's about what's right and wrong.
Beth, thank you so much for joining us today and allowing us to help share your story. I'm really always interested in the journey from patient to patient advocate. Is there anything that you want to share? Like, how did you 18 years ago, you got diagnosed with a blood clot condition. How was it that you became, a patient advocate and really wanted to help share your story for the benefit of others?
Well, first, thank you so much for having me here today. And my journey as a patient advocate actually began 19 years ago today. Today is the anniversary of when I was first hospitalized with deep vein thrombosis and pulmonary embolism, clots in my legs and clots in my lungs, which were initially misdiagnosed. It was not until I had a near fatal episode of a clot breaking off, passing through my heart, and lodging in my lung that I received the correct diagnosis and treatment. And so it was really out of that very negative experience that I first began motivated to become engaged as a patient advocate, to begin volunteering with nonprofits to increase awareness and education surrounding blood clots. And out of that, I volunteered with a number of national national nonprofits surrounding blood clot education. I helped found a education program at the University of North Carolina in Chapel Hill called Clot Connect. And because I'm high risk for developing another blood clot in the future, I take an anticoagulant medication, a blood thinning medication, and will need to do so for the rest of my life to prevent a recurrence. So it's absolutely crucial that I follow my doctor's instructions and I take my medication exactly as he prescribes. And the choice of medication is something that my doctor and we discuss at each and every appointment because it is so very important. We discuss changes in my health, we discuss my risk for bleeding, we discuss my risk for clotting, and then we make a decision together about which medication I should be on. And over the course of the last 19 years, we have made changes in which medication is appropriate. For the last 8 years, I have been stable and doing well on the same brand of blood thinning medication until November, when I go to my mailbox and there is a letter from my insurance company's pharmacy benefit manager, which is CVS Caremark, informing me that the medication I've been taking for the past 8 years was no longer going to be covered and that I needed to switch to another brand of medication. And that was it. It did not even include a phone number to call if I had a question. It did not mention an appeals process. It simply said, ask your physician for a prescription for another brand of medication, or else be prepared to pay the full retail price. So I was completely shocked. I had made such thoughtful treatment decisions with my physician, and I had no idea that my insurance company could essentially step in and change the anticoagulant I was on after I had been stable for the past 8 years. So that's really when my advocacy took another new turn in the direction of looking at non-medical switching. And as I was researching options for my own care, I found out that I wasn't the only patient who received that type of letter, that there was around 150,000 other cardiovascular patients nationally who were also impacted by this formulary change. And I learned that there were a number of nonprofits such as Mended Hearts who were working on the issue. And this is sort of how I got engaged as a patient advocate on the non-medical switching issue.
Sure. I mean, so it sounds like your patient advocacy did not just start in November when you got that letter. You've been a patient advocate for about 18 years, or exactly 18 years. But really non-medical switching kind of became a focus when it really impacted you just in this last year. So that's great. I know through reading your story, I know you've got a website, bethwaldron.com, that you used to work actually for insurance companies. What role do you think that played in like kind of understanding the process and understanding, the healthcare system, that you had that experience working in healthcare?
Well, I think it helped me better understand the business side of the insurance industry and how, healthcare decisions get made in that business environment because, the fact of the matter is whether we like it or not, in our country, we do have a for-profit model of healthcare delivery. And much of our access to care is managed by corporations who have to meet shareholder expectations. So decisions are often made for purely financial reasons, not necessarily what's in the best interests of patients clinically. So I think my background in the insurance industry helped me sort of appreciate that context.
That's great. And, did you even know what non-medical switching was before you became like entangled in this whole CVS decision?
No, I had never heard that term before. I had worked in and around healthcare for 25 plus years, but I had never heard the term non-medical switching. And to be honest, I had no idea that anyone other than my doctor could decide which treatment was best for me without knowing my unique medical history, without knowing my background. It's really quite shocking that such a thing is legal. That essentially the corporate practice of medicine is what we're talking about. That
Yeah.
because of a benefit structure of what's covered and not covered, that your medication can be changed. That's really quite shocking.
Yeah. It really is. I think it sounds like, insurance really make this decision really based on a profit motivation, or to, be able to increase their negotiating power with pharmaceutical companies, but really the one who gets hurt is often the patient when they've been stable on their medication. When you thought about, having to switch off of your anticoagulant to a different one, what kind of like emotions did that elicit? Why was that so impactful for you?
Well, it was impactful for me because, I mean, first of all, this is a medication that I depend on to prevent a life threatening condition. I mean, I nearly died from a blood clot. But this is also a medication that comes with great risks. It hit home for me very personally. Anticoagulants are a very special class of drug, and it comes with a risk of bleeding. That's the main risk that this class of drug comes with. And in fact, it's the number one class of drug for adverse events. I think few people realize that there are more emergency room visits from anticoagulants than from any other class of drug, even opioids. My own father, he took a blood thinner to prevent blood clots, and he developed a bleed while he was anticoagulated that the doctors were not able to control. And unfortunately, he died as a result of his bleed. So, I personally am very, much aware of the risk of clotting, for myself, and from my dad's experience, I'm also aware of the risk of bleeding. And so I place a really high premium on optimal anticoagulation management. And I only want my doctor and I to be making that decision. I don't want my insurance PBM to be the one deciding which medication I should be on. That needs to be a decision based solely on clinically what is the best medication for me and my unique situation.
Yeah. Yeah, I mean, especially if you have been impacted
Mhm.
by a complication from an anticoagulant, I can see why this felt so impactful and so detrimental to want to take action. Yeah, I remember reading somewhere that, one of the requirements was that you needed to fail first on the
Mhm.
other anticoagulant before, you could go back to the one you knew that was working. Why is that such a ridiculous concept for anticoagulants?
Oh gosh. Well, when this first happened, I mentioned the letter didn't say if there was an appeals process, and I first started calling and asking questions, and I found out that I could have my doctor ask for a prior authorization. But one of the approval criteria required that you first had to take and fail the new medication. And so, well, what does failure mean on an anticoagulant? Well, that means developing a new clot or an adverse event like a bleed. So both of those are potentially very serious, potentially fatal events. And so that doesn't sound very attractive. And what's also nonsensical is even if you had a serious event, let's say you had a clot or a bleed, and you say, okay, we're going to approve you to stay on the medication you've been on and doing well on for many years, it would then be at a higher copay tier, making it subject to coinsurance and deductible. So for me personally, it was going to cost an additional $2,400 a year for me to stay on the medication I had already been on and doing well on for the past 8 years. So, for an anticoagulant, it really seemed rather ridiculous that you would have to suffer an adverse event, and then you would have to pay more money on top of that. It just didn't make a lot of sense.
Yeah. Yeah. I want to get into your advocacy online here in a minute, but if we can just kind of go off, I'd like to know kind of, you sounds like you called up your insurance company. So
Mhm.
what were your reactions? It didn't include, there was no phone number, it just said, we're going to do this to you. You're just going to have to talk to your doctor and get prescribed another. So what were the personal steps you took on your personal self advocacy to really try to get to the bottom of this before you really kind of went online and garnered a lot of attention from the community on this?
Well, the first thing I did is I contacted my insurance company, my plan, and found out, what the steps were to if there was an appeals process. And that's when I learned about the prior authorization steps. And my next step after that was I contacted my physician, my hematologist, and said, what do you recommend? Which medication do you recommend? And would you recommend filing for a prior authorization request? And would you work with me? Because the physician has to be the one to file the paperwork for any type of prior authorization request. So I tried to work through my insurance company. I tried to work through my physician. And then another thing I did was I contacted the pharmacy to find out, well, how much was it going to be if I just simply paid the cash price? How much was this medication? And unfortunately, it was around, I think, $640 a month, the cash price. So that was really not going to be feasible. So I think part of it was information gathering. I sort of went into a mode of trying to get all the facts to say, okay, I have this. Do I want to switch? And if I don't want to switch, how much is it going to cost me? And is that realistic? And trying to gather enough information to make an informed decision.
Sure, sure. So, and you do have quite a following on Twitter, 1,200 followers. Kind of what led you to want to take this advocacy? What was the decision to take this advocacy online? Particularly Twitter, and what were the results?
Well, I'm old enough that I took a typewriter to college, so turning to social media was initially a little uncomfortable, to be honest. But when you feel small and helpless, social media can be a great equalizer. And I wasn't sure how else to reach the company because I felt no one was listening. I don't have the resources of a corporation like CVS Health. And I decided that if they were comfortable taking away my long-time effective medication, then they were going to get to know me and they were going to get to know other patients impacted by the decision. So, in effect, I decided to become a squeaky wheel that my insurance PBM couldn't ignore because, patient stories are very powerful. We're the human face of these corporate decisions. And fortunately, it worked. I'm pretty sure they know who I am now, and they know who lots of other cardiovascular patients are now.
That's great. Um, in your opinion, what were some of the motivating factors for CVS to reverse course on their anticoagulant decision? And, what role do you think patient advocates played in that reversal?
Well, I think this is a prime example of the power of collective action. It wasn't just any one person or one group of people. I mean, we had patients, physicians, pharmacists, clinicians, and nonprofits sort of all coming together and speaking out against this formulary drop. And I think that really speaks to how dangerous this really was. In total, I think there were 17 nonprofits that at some point took some level of action against this, asking CVS to reverse course. And unfortunately, some of the feared adverse events among those patients who were forced to switch did begin to emerge. There were documented reports of strokes and bleeds, and patients like myself who began to speak out both on social media and to reporters and the traditional news media, began sharing stories of these harms. And so I think all these things sort of coming together collectively, brought CVS and the manufacturers of Eliquis, BMS and Pfizer, back to the table to finalize an agreement to get Eliquis, back on formulary for patients.
That's great. I've noticed that you've kind of taken on another issue with CVS as of late with their corporate retreat online,
Oh,
and um, and their choices for entertainment. Can you talk a bit about that and the kind of responses you've gotten? Because I know that some of that attention has gone beyond just anticoagulant patients in the cardiovascular community.
well, recently CVS Health posted their second quarter earnings of $8.6 billion dollars. And the very same week, they had a leadership retreat in Orlando, Florida. And there are lots of pictures circulating on social media of the attendees. They posted pictures of lavish parties, wonderful looking food, and trips to Disney. And to top it off, they had a private John Legend concert. And I don't know what it costs to get a celebrity to come to your corporate party and perform a private concert for your leadership, but I'm pretty sure it's pretty expensive. And this struck me as just so very wrong when it was the exact same quarter that you profit off heart patients not being able to get their blood thinning medication. So I made a post about it on Twitter, and I shared some of the photos and some of the videos from that party. And it just took off and went viral. And I had one tweet that got almost 2 million views. And it was just shocking to me because it really seemed to hit a nerve among people and people weighing in, and not just heart patients, but people about all kinds of medications issues that they had. And so I think, this is a widespread issue that affects a lot of people that who've had difficulty getting their medication. A lot of children, people who've had difficulty, they're stable on one medication or they have to go through step therapy, trying and failing multiple different medications before they can then get the one that their doctor recommends. And so I think people have clearly had enough of struggling with some of these challenges. And then when you see these sort of corporate excesses at the same time while patients can't get access to the medications they need, at the same time that we're paying premiums, insurance premiums, there's just a disconnect, I think. And I think that really sort of struck a chord with
Yeah.
me. Yeah.
I think people, you going back to something you said earlier about it being we live in a
Mhm.
corporate profit driven healthcare system. And I think that for a lot of people, seeing corporate profits on
Mhm.
display like that
Mhm.
and knowing at times at what expense to the patients, it feels like, that the interest should be on
Mhm.
helping patients more than corporate profits oftentimes. But
Right.
so what steps would you take? You laid them out for yourself, but I
Mhm.
think you've got some tips for patients who are interested in, potentially their own self-advocacy if they find themselves in a
Mhm.
similar situation, whether through non-medical switching or maybe another
Mhm.
formulary change, or changing their benefits at work. What kind of tips would you provide, you know, to patients if they find themselves in a situation where, similar to yours?
Right. Well, the first thing you've got to do is ask questions and do some research. When I first got the letter, my first reaction was, "Oh well, I guess I'm going to be changing medications." And then the more I thought about it, I thought, "Well, wait a minute, this isn't right. This isn't what I really want to do. This isn't what my doctor really wants to do." So I started doing my homework and I started, sort of asking questions. So the first thing you've got to do is kind of do your homework. I would say contact your insurance company. Ask if there's an appeals process. Ask if there's a way you can be grandfathered in. I think that's one thing that's a little bit concerning is that, it's one thing for there to be formulary changes. It's a little concerning that stable patients aren't grandfathered in when they've been stable for a number of years on their medication. So ask questions, ask about the appeals process. You may hear this called prior authorization. Ask if that's a possibility. The other thing I would recommend is contact your pharmacy and ask what the cash price of the medication is. Depending upon what the medication is, I have been shocked to hear from some patients who have found out that the price they've been paying under their insurance benefit is actually higher than the cash price of the medication. So they actually are saving money when they start paying the cash price. And so, find out what it would be if you just pay out of pocket. The other thing that was very helpful for me is contact the drug manufacturer and find out if there are patient assistance programs. If there's a copay card or other type of patient assistance. In my case, I was able to get a copay card, which helped me afford the retail cost of my medication until I could sort of get things figured out. It bought me a little bit of time to kind of figure out what my options were going to be, and it allowed me to stay on my medication for a longer period of time. So definitely contact the manufacturer of your medication. Another thing I would suggest is if you get your benefits through your employer and you're comfortable doing so, contact your human resource benefits office. Let them know you're not happy, with this, because ultimately your employer, they're the client of the PBM more so than you. And they may be able to offer some assistance. I know sometimes patients are a little bit uncomfortable talking to their employer about health issues, and you don't want to disclose too much to your employer. That's understandable. But sometimes your employer benefit office, they need to be aware that you're not happy with your benefits coverage, and they might be able to help. And the biggest advocate I found are your physician's offices because they deal with these issues, unfortunately, frequently. And so they may have tips, they may have, again, copay cards or coupons or things that can help you. So talk with your doctor. They'll at least be able to tell you what your options, if you do have to switch medications, are, can work out a plan to transition.
That's great. Great tips. Really appreciate it. So, and what resources would you recommend for patients who maybe want to learn more about non-medical switching? What have you found has been beneficial?
Well, one of the things I did is I just went on Google and started searching for non-medical switching, and there's a lot out there. But I think a particularly helpful resource for patients in the cardiovascular community is the nonprofit, the Partnership to Advance Cardiovascular Health. They're online at advancecardiovascularhealth.org. They have a nice series of educational videos and materials specifically on non-medical switching as it relates to cardiovascular patients. And that's particularly helpful and can give you some good background information.
Great, great. Well, Beth, I really appreciate you taking the time to share your story today. And I don't know if anybody has any questions in the audience. Got a couple of cheering comments from fans out on Facebook, but could you say those names again? I think those names meaning the Partnership to Advance
Oh,
Cardiovascular Health. Yep.
that the Partnership to Advance Cardiovascular Health, and their website is advancecardiovascularhealth.org. And I believe the non-medical switching information, they have a section of their website called No Big Deal. And it's sort of the irony because it is a big deal. And if you look on there, they have some position papers specifically about blood thinners, and they have some educational videos and some resources that I think are particularly good.
Great. Great. One last question. How did you feel like your career in healthcare prior to becoming a patient advocate really helped you prepare for the work?
Well, they say things happen in life for a reason, both the good and the bad. And I'm not a clinician. My career in healthcare is more as a paper pusher, I like to say. But it has informed my understanding of the healthcare system, and it's helped me navigate it better as a patient and as a caregiver, and now as a patient advocate. So, I mean, the truth is, we have a complicated health system. And when you're sick and you're not well, you really do need an advocate to help guide you and ensure that you get the care that you need. And I like to think of what I'm doing now as an advocate is what I would be doing for a family member, but just on a much larger scale.
It's great. Beth, again, I am so appreciative of you to share your story. I think, you're I said this to you before. I think you're exactly, what we want to inspire in other patient advocates is to like take that next step, do all the steps. I think a lot of times people just receive those letters and feel, kind of small, as you mentioned. And what can you do to like band together, create collective action, kind of advocate for yourself? Um, I think all of those are like important components to really seeing this as a huge success for the cardiovascular community, of which you were, I feel like a critical component of this success. So thank you for all of your advocacy. Laura had one last question. I'll take it. Do you know of other patient advocates who kind of, were in the same vein, in the fight with you, to get this decision reversed?
There were lots of patients impacted by this. And what I found is by going online and by talking about this on social media, I was able to sort of connect and network with those patients. And I also found that not necessarily cardiovascular patients were a huge help because, again, so many patients have been impacted by non medical switching, patients who have been impacted by this for years, who've gone down this path before us, who were able to share their experiences and say, okay, here's what worked, here's what didn't work, here's what and they were able to be a moral support, really, because there were lots of days where this feels like an insurmountable challenge. And it's nice to at least have other patients kind of standing with you and saying, "Okay, keep going. This is, we're with you." So that's yes. There's a whole that is sort of, I think, one of the beautiful things about social media is that even though we can be separate and working independently, we can all kind of connect up and be one community together and united in a cause. And that's been sort of the beautiful thing I've seen. And I really think, and I hope this can be a model of how patients and physicians and nonprofits, we can all kind of work together collectively in the future on additional issues, because we know there's lots of things we need to work on and improve in healthcare. And I think this shows that when we do work together, we can make change. We can have positive impact. So I'm hoping we can continue this momentum going forward.
Thank you so much, Beth. I completely share that sentiment, and why, we at Mended Hearts do what we do is to try to spur that collective action and try to work with patients and providers and nonprofits to really move the field forward and advocate on behalf of the patient voice. So thank you again so much for all of your time today, and look forward to continuing to see you on Twitter. For those of you who are not following, it's Beth J. Waldron, right? On Twitter, is that right?
It's Beth Waldron, just Beth. Yeah, Beth Waldron.
Beth Waldron. Okay, sorry for putting the middle initial in there. I must have read it wrong. So Beth Waldron on Twitter and bethwaldron.com. Anything else you'd like to say in the departing words?
I just want to thank Mended Hearts and as a nonprofit, it really, if nonprofits like Mended Hearts had not taken a lead and taken a strong position for patients, this would not have happened. Change would not have happened. So really, it takes a community. It takes all these pieces coming together. And so I just want to say thank you and keep up the good work that you're doing. I mean, it really, it takes all of us. It really takes all of us.
Thank you, Beth. Thank you.
Thank
Well,
you.
look forward to staying in touch. And I think in the chats, we have put our link to join the Action Network, a group of patients dedicated to advocacy efforts on issues like non medical switching. So feel free to follow that link and sign up for our Action Network today. And thank you again, Beth, and
Thank
have
you.
a great weekend.
Thank you.